today is going to be nutrition for the holidays. And it is avoiding the holiday stuffing. And I have to give credit to Jenny. Raise your hand. Because Jenny is the one who gave us the topic. But what I love, look at this picture and look at the cat. And think about us after I looked long and hard for a photograph that really captured how some of us feel after a big meal, but especially after the holiday meals. So I had to start you with this, and I had to thank Jenny for giving us this topic. But think about this little kitty cat, not so little. And Josh, we're going to go to the next one. And this is called Holiday Healthy Eating. And so what we're going to look at is what are some tricks that we can use to get us through the holiday season. Do you remember we've had a discussion about fiber and high fiber foods, right? Does anybody remember why fiber would be high fiber foods would be good for us to eat? What can you think of?
Slow digestion.
It slows digestion. That is perfect. Yes, Gary, good. What else? I'm going to show you. Okay, you ready? So imagine you're eating food with a lot of dietary fiber. As we swallow that food, the fiber tends to pick up water when we're digesting it. And as it picks up that water, it fills our stomachs more. So it gives us that feeling of fullness if we stop to listen to the message. Okay, Josh, give us another one there. Here's another one that's super, super important. And I am pretty sure that everybody will understand this. The closer we are to a food, the more we tend to grab for that food. And I've used the term attractive nuisance, because if it's sitting there close to us, even without thinking about it, we're pulling it. And I'm going to give you a classic example of this. Since we all used to have Halloween or celebrate Halloween in our houses, and we can't this year probably, in our house or in our neighborhood, we used to have over 100 kids that would come to our house for trick-or-treating. So I, of course, the dietitian, the dentist's family, would buy all the candy, but we'd give out toothbrushes as well. But we would have, as our neighborhood grew older, we'd have fewer and fewer trick-or-treaters. But I still had the amount of candy. So the day after Halloween and all of the days after that, I kept them in a container or in little bowls next to my front door. Now picture this, the way my house is set up, I usually walk from my bedroom to the kitchen in the morning. It's a direct route, except right after Halloween, I would somehow manage to go by where that bench of candy was, grab some, and then go into the kitchen. And I don't even like candy, but that was the attractive nuisance there. So you get the point on that one, right? So let's go ahead and look at the next one. And this one is, can you skip the foods? Can you just say no to something that is there in front of you? And that's why I say if you combine proximity, the food to your plate, or skipping it, those are sort of connected. So start early, fill with foods that are going to make you feel fuller. Don't keep foods close to you. Skip certain foods, and let's look at the Thanksgiving type of a table. What kinds of foods are you really not crazy about? Can you say no to those? And so Joshua, let's take us to the next one. And obviously it's what we've already talked about. The more fruits and vegetables you fill your plate with, the more you're going to have good nutrition, you're going to have higher fiber, and you're probably going to, hopefully anyway, feel less of a tendency to grab the foods that may not be as nutritious or nutrient dense. Let's go to the next one. And now I think you'll recognize this. Whenever we're with other people, you get so busy talking that you're feeding yourself and you're eating so fast that you don't even notice that you are continuously eating. So again, being aware of some of these triggers may help you. And I'm going to ask that Joshua post this PowerPoint when we're done, and then you can go over some of the helpful hints. All right, let's take us to the next one. And this is something that we've already talked about. Can you keep track of the food that you're eating? And obviously, when you're eating, when you're eating, especially at a holiday meal, you're not going to sit there and write things down. So I understand that, but sort of in your brain, keep it in mind. And Josh, click this next little point because this is a shocker. The average weight gain, and this is by research, from Tufts University, the average weight gain between Halloween and New Year's is about 5 to 8 pounds. That's the average weight gain. And that's not very much time between the end of October and January 1st, 5 to 8 pounds. And if you think about extra 550 calories per day, that's 3,800 extra calories per week. And that is a pound of extra fat a week. So let's go to the next one. I want you to keep that in mind, but not freak out. Okay, so looking at how do we measure up, and again, we've talked a little bit about this, but I want to show you some things that are really important. What's in a cup? And if we think about a cup, this is a cup. All right, Josh, to the next one. What's in a tablespoon? And think about this. This is a tablespoon, and we're going to go further on that. But a lot of times when we're grabbing a spoonful, and you'll see this when I talk about gravy, you're thinking that this is just a teaspoon, but actually it's 3 times what a teaspoon is. That's a tablespoon. So notice that if you're talking about a teaspoon of fat, that's 45 calories. But if you've actually taken a tablespoon's worth, or even a ladle spoonful of worth, it's a whole lot more calories than what we had even imagined. Okay, Josh, let's hit us to the next one. A serving of protein. And do you remember what we had talked about with food and serving sizes? And Sahar and I covered that. But a serving of protein, if we look at a 3-ounce measure of a chicken breast, that's a serving. Okay, and Josh, we can go to the next one. A serving of vegetables. And also I talked about how easy it is to use the palm of your hand. This is a serving. So when you're thinking again back to how do I record, how do I keep track, be realistic about what a serving size is. And Josh, we can go to the next one. How much fat do I need? And with that, I'm going to talk about how much fat is in food, because this will really blow your mind, and I'll go over that. But I want to show you something that's really amazing. All right, so this, I don't know if you can see this. This is how much fat is in 3 ounces of chicken roasted with no skin. Can you see this fat? Got it? Okay, now I'm going to show you, look at this one. Okay, show you the difference. This one is 3 ounces of lean ground beef. This is the amount of fat in 3 ounces of lean ground beef. Okay, so now I'm going to show you something really mind-boggling. Okay, going back again to the skinless chicken. Now I'm going to show you this, and this is how much fat is in a small serving of buffalo wings. Right, so that's rather astounding. So we look to see, and we've talked about how do I figure out how much I need? Well, I want you to be aware of how much fat is in food. And then, of course, go to the next one, Joshua, please. And that is, again, going back to keeping track. So we take us back to the MyPlate. And here's again where we go. This is such an easy thing to navigate. If you go to ChooseMyPlate.gov, this is probably one of the best tools that we could possibly imagine. Because if you look at a plate and you know what it's made of, and you know, you can see from that half of a plate, when we find the averages in a day, are supposed to be filled up with what category of food?
Veggies.
Yeah, veggies and fruit. So half of your plate, half of the foods that you eat in a day, half of them should be fruits and vegetables. And so you look at the grains, those are all the carbohydrates. You look at the smaller amount of protein, and then you can look at the dairy. But if you go to ChooseMyPlate, that's probably one of my very favorite websites insofar as easy tools for everybody. Now let's go to the next slide. And I want to show you, this is also one of my favorites. They're all my favorite handouts. But again, looking at how easy it is for us. My thing and Sahar's thing, when we're talking about nutrition and working with patients, we don't want to make people obsessive and we don't want to make them worry about things. But knowing up front that between Halloween and New Year's, that's the time where we tend to eat more of the calories because the different kinds of foods are just around. It's helpful to understand serving sizes. So again, one thing I didn't mention before is that if you hold up your fist, that's about a cup. So everybody hold up your fist, right? That's a cup. All right, now if you open your hand right in here for meat or chicken or fish, that's about 3 ounces. For a veggie, that's a half a cup. Now here's another one I wanted to show you. Okay, so look at your thumb. Let's see if I can get it there. All right, look at your thumb and look from the joint of your thumb down here to the top. That's about a teaspoon. Okay, so know that that's a teaspoon. And if you, I'm sorry, the tip of it is, the whole thing is about a tablespoon. And then we talked about looking at 1 ounce of nuts. And we talked about a serving that is about a cup. And this is also going to be like a tennis ball. So having your hand around, you can sort of guesstimate the size of the foods that you are eating. So Josh, let's go on to the next. And then we understand that it couldn't be any easier. And I would like everybody in the audience to repeat our 4 words that you know over and over again. Are you ready? It's balance.
Balance.
Variety.
Variety.
Next one, moderation.
Moderation.
And we balance it with exercise.
Exercise.
Right?
Exercise.
Perfect. So you look at all of these, and balance means that you look at all of the different food groups on that plate. You balance them all. Within each food category, you have a variety of foods. And this is the biggie, and I always say this because it's so important. Moderation means it's okay to have the Oreo cookies. It's okay to have the pumpkin pie or the chocolate pie, but just don't eat the whole thing. Moderation means stop feeling guilty. And no matter what your age, if you look at this young lady over in the corner, she is doing her exercise. And so it's whatever kind of exercise you can do. All right, Josh, let's go on to the next one, because speaking of exercise, this is one of my favorites. Okay, hit the first button. This is just a crack up. Okay, first, next one. Look at this. So when I look at my gym parking lot, at the end of the year, it's pretty empty. But come about January 3rd, the parking lot is filled, right? So I see that, and it's hard to find a parking place. So now click to the next one, Joshua. This is what it looks like again, actually probably the 2nd or 3rd week in February. And we see that at the Student Center as well. We see more activity in January, and then we settle back into our own old ways of life, and we start to lose that commitment to the exercise. So all of us, whether we're in nutrition, dietetics, or in exercise, athletic training, kinesiology, any of those, the whole goal is that we want to encourage people, not discourage. We want to encourage people to at least be consistent. And then the other thing is most gyms run membership deals in January. So you'll get a lot of people signing up. And then it's like you see in January, the parking lot is full, but people will join. And then even though they've paid that annual membership, they still don't use the services. So with our CSUN students and the Student Recreation Center, and with the students having access to the Student Rec Center and the gym, if we could just continue to encourage them when they do come back. And I don't know, do you know what the setup is at CSUN with the rec center, Student Rec Center, SRC?
In what sense?
In what sense do they restrict the number of students who can come in to work out?
Oh, I don't think so. For the most
Okay,
part, I don't think they've ever said that like they've reached a capacity and no more students come in. It's pretty much, I mean, it's 3 floors, so I don't think they've ever had that problem.
Perfect, perfect. So here again, the benefit that we have for our students is it's free. The other benefit that we have if they're coming to school, to classes at all, is it's right there on campus. Now with more Zoom meetings and distance learning, it may be a little bit more challenging, but still most of our students at CSUN have been commuter students. So if we've got that general population and it's not too far away and they're not living too far away, they can come over and take advantage of our services, because that SRC is to die for. And it was also built, the other thing that we can stress is that was built with student fees. So student funds put into that, they have access to it now for free, and it is magnificent. So the more we can encourage our students to use that, all of us leading by example, the better off everyone will be actually. So let's go to the next slide, please, Joshua. There we go. And then you all know this. So this is old news. Energy in to energy out. If we can keep that the same, our bodies are going to burn energy through metabolic process, through the foods that we eat, and through exercise. Our energy is coming in basically through the food and beverages that we drink. So if we can figure out what is it that keeps us in energy balance, that is awesome. But we need to, again, that's a matter of keeping track. It's a matter of getting used to what we're looking at. All of those things that play together. We want to make sure that students are keeping, or everybody actually is keeping, an energy balance. Now I see a question on the chat. Is it a question that we, let's see, can I? SRC is one, yeah. SRC is the one thing that you missed. How many here on the call have used the SRC? Fantastic. Okay, it, again, I don't think, no matter, I mean, I am an alumni of UCLA and of Cal State Northridge. And until the SRC was built, I have to honestly say that I have never seen a better facility, a more magnificent place than that. So yeah, Josh, I get you. It would be something that I would miss terribly as well. So let's look at this. So go to the next one. I want to show you this because I think it's kind of fascinating. Go to the next slide, please. And this is home for the holidays. This is what I want you to look at. Look really closely. So a chicken breast with skin is 194 calories and 8 grams of fat. We're not going to even look at the protein thing column right now. A chicken breast without skin is 161 calories, but it's half the fat. All right, so you see where you're getting that nutrient. And here's the thing, this is going to be because I'm a dietitian. So let me tell you that if you cook turkey with the skin on, or cook chicken with the skin on, that holds all the moisture in. Then when you go, and the flavors, Then when you go to eat the chicken or the turkey and remove the skin, you've got all that moisture, you've got all that flavor. It's not like you have to cook without the skin. So that's just really a way of making something much more flavorful. Okay. Now go to, if you look at the next one, the wing with skin. Oopsie, sorry about that, Joshua. Go back to the other one. Sorry, that's my fault. All right, so if you go back to the next slide and you see a wing with skin, that's that tiny wing. Eating the skin, there's hardly any meat with it. It's 238 calories and 13 grams of fat. So look all the way down there and you're going to see the difference in the kind of meat, the kind of what the skin does if you're eating the skin. But remember, you can consume it without the skin. Cook it with, keep the moisture in, keep the flavor in, and then cook without the skin. All right, so let's go down to the next one. Now we're ready for this. Thank you very much, Joshua. All right, check this out. This is 194 calories. Pretend that that's just a 3-ounce breast. It's actually, I found the photograph of a thigh, but pretend it's a 3-ounce breast. So it's only this size. And that's just under 200 calories. If you have the large breast with the skin, that 12-ounce breast, so it's 3 of these. And remember, if it's in your vision, you're more likely going to consume the whole thing. That's 800 calories. So if you think about the 600 calorie difference and then think, remember one of the things that I said is if we're eating an extra 550 calories a day, and so you're seeing an extra 600 calories just in that serving size. If you're eating an extra 550 calories a day, and you've got all that holiday eating, at the end of the week, your body is storing an extra 3,500 calories, and that translates to a pound of stored body fat. Okay, so looking at size, looking at all of these different entities, it makes sense that you can understand where those calories are coming. All right, so let's go to that next slide. And this is a mind boggler too. And again, Jenny, I'm going to thank you forever and ever, a million times over because of this topic. It just is absolutely perfect. Even though it's like 300 degrees outside, it's still a topic that we need to be aware of in advance. So gravy, if you look at gravy, how many of you have ever eaten gravy? Right, so as a person who is a vegetarian, yes, I love it too, Jenny. If you're looking at gravy, 1 tablespoon of gravy is only going to be 15 calories. But generally speaking, what we do is we load it. We pour it a lot, and it goes over our mashed potatoes, and it goes over all of the turkey or everything else that we're eating. And you're looking at just in the gravy, an extra 120 calories. So again, translate that to 120 calories in 1 serving, a half a cup. Translate that to extra that you're consuming in a week and translate what your body is reading of where it's going to store things. Okay, so easy to understand and easy to see. And then as you're looking at it in the graphic, what I want you to do, everybody look at this tablespoon. Got it? Close your eyes and imagine it. Picture the gravy. Picture your plate. And open your eyes again and remember the serving. Got it? I don't want to ruin your holiday eating, but I want you just to be aware of it. And it's the days afterwards as well. All right, so let's go to the next slide, and you're going to see the stuffing. And again, stuffing is fantastic. How many of you have ever eaten stuffing? Raise your hand. Yeah, and it is awesome. And again, as a person who's a vegetarian, this is so funny. The kind of vegetarian that I am, I do eat stuffing. I'm not a vegetarian because, I shouldn't say this, but because of the animal rights thing. I'm a vegetarian mostly because of the health aspects of it. So I don't have a problem with eating some of these things. And I do love stuffing and I love gravy. Um, so there you have it. But just be aware that 1 cup, this is a cup, that's going to be 326 calories per cup. If you, and nobody, I know, let's be realistic, Lisagor, nobody's going to eat just 1 tablespoon of the stuffing, right? Yeah, I get it. I get it. I get it. But Thanksgiving is one thing. And then it's the leftovers and understanding and being mindful of what is it that we're doing continuously. Okay. And just being aware of that. All right. So let's go to the next slide. And speaking of potatoes and mashed potatoes, I don't know what your home Thanksgivings are like, were like, used to be. At my house, we would generally have 35 to 40 people. And I would make 3 turkeys, barbecue 2 of them, and just love watching people be around. Obviously, we're not going to be doing that this year. It's just going to be my immediate family. So it's much smaller, but mashed potatoes for us, along with the sweet potatoes, that was all a part of Thanksgiving. That's the tradition that came from my mother, my aunt, my grandmother, my great grandmother, all of those. So each culture is going to have its own little spin on that. But just take a look, 2 tablespoons of mashed potatoes. So 2 of these, that's 45 calories. 1 cup is 350 calories. So again, we're looking at serving sizes and quantity and understanding that this is the reality of it. So if we're wanting to look at what's going into those 5 to 8 pounds that we put on between Halloween and New Year's, you're looking at it right there. But it's also something when we look at serving sizes, not just for the holiday, but at regular times as well, should we ever be at regular times again. All right, Josh, let's go down to the next one. And here's something that I'm sure you all recognize. Anybody who has a traditional American type of Thanksgiving, pumpkin pie, chocolate pie, those are part of the traditions here. Anybody have any different types of desserts for their holidays? Sahar, how about you? What's your family have?
We love like a peach or pear cobbler. So
Yeah,
easy to
yeah.
make, just like canned peaches or pears and some granola on top, and you bake it. Comes out so good.
And do you put whipping cream on top?
Vanilla ice cream.
Okay, okay, perfect. Thank you for sharing that. Joshua, how about you?
We're pretty traditional. We go. I love pumpkin pie. Anything pumpkin, I'll eat it.
Yeah, it is so good. Jenny, how about you?
Same with Joshua, pumpkin pie all the way.
All the way. And
Yeah.
Gary, how about you?
Oh, we're traditional. We have all the pies plus cookies and it's too much.
I mean, it is, and the way that we have it, and I'm sure it's like that for you, it's sitting out there, right? And you can take the pumpkin pie or the chocolate pie and you slice it into 8 slices and you eat your slice. Well, traditionally, even that with the cream on top, whether it's whipped cream or ice cream, it's about 500 calories. But now the servings that we're getting from the holiday pumpkin pie or the chocolate pie, it's really more in the neighborhood of 1,000 calories. So again, just being aware, you're seeing that we're inching up the amount of calories that we're taking in, and we don't even think about it. And again, I want to stress the moderation thing, and I don't want to laden people with guilt about the traditional holiday, but knowing that we sort of forget to get out of that holiday mode after that meal, that's the tough part. We get attuned to it and we stop even thinking about it. And it's again that attractive nuisance, it's there. So let's go on to the next slide. And this I think is going to boggle your mind as well. Traditional holiday beverage for us anyway in the United States is an eggnog latte or an eggnog. One cup, and this is a cup, is about 210 calories. If we're doing the apple cider, hot apple cider, depending on what we put in it, it's between 80 and 140 calories. So yes, yum for both of those. And eggnog is the traditional holiday Christmas drink. I mean, it's there all the time, right? So let's look, let's see, are there a couple, your kryptonite? And eggnog, yeah, absolutely. I am so with you on that. It's delicious. All right, take us to the next slide, please, Joshua. And let's take a look at these traditional things. And even if you put whole milk and sugar in your coffee, it's only 45 calories for an 8-ounce cup. If you look at a steamed mocha mocha coffee with milk and mocha syrup, whether it's Starbucks or any of the coffee places, that can be 350 calories. That's just a beverage. But if you look at iced tea or water, that's 0 calories, right? So again, just being aware of it. Cold brew. Jenny, share that with us, please.
Starbucks started making this drink. I don't know if they had it for last holiday season. What they have now is they have their cold brew, which already has, the venti one I know has 3 pumps of vanilla in it already. And then with their cream foam thing, it's heavy whipping cream and milk, and they put pumpkin syrup in it. And I don't know what else they put in it, but it's so creamy and good. And because I've been reestablishing my relationship with dairy again.
Okay.
Been getting it a little bit too much. Recently, I have been cutting down on the sugar though. So if I were to get it, I'd either make it half sweet or I'll substitute it for a sugar-free sweetener. So I've been better, but when it first came out, I was getting it like 3 times a week.
Yeah, and again, you know what? We have Starbucks everywhere. I mean, I have to say that we have Starbucks when we're doing our service projects in Nepal. There are Starbucks there. It's like, really? In third world countries? Yep. We're everywhere, and people so get used to that. I have a question for you, Jenny. When you were restricting more from milk products, from dairy, and you started going back to it, how'd your stomach handle it?
It bloats. It still gets bloated. The dairy just tastes so good. I don't want it's like I haven't had it for 2 or 3 years, and then when you get back to it, it's, I don't know if it's like a drug or something, but it just tastes so good and you just want to have more of it. However, I do know that you gotta have it in moderation. So
exactly. But I'm going to give you a scientific explanation for what happened. When you were off of dairy for that long a time, your body did not produce as much lactase. So the enzyme that breaks down the dairy, that lactose sugar, your body wasn't producing it because it didn't need to waste as much energy doing that. So for those who have gone dairy free but then bring it back, you have to do it at a slower pace. So your body says, oh, she's having me again. We better start making that enzyme again. Isn't that interesting? But that's our body trying to adjust, trying to figure us out. And we throw at curves all the time. But so what you're doing, I mean, your body's reaction to it was exactly what your body was supposed to do. It's just learning you again. So as you try it slower and slower, your body should start adjusting and you would get rid of the problem. Okay. Fingers crossed. Okay. So let's go to our next slide, please. And again, this goes back to what we were saying earlier. The more you have larger calories in than the calories that you're expending, what do you think is going to happen?
gain weight.
Gain weight.
Yeah, that's exactly what happens. So again, your body gets, remember we had talked about a set point. So your body gets used to knowing what your weight is supposed to be. And it's always going to try and keep you at that weight. But as you start to add calories, and you're not expending as much, and that's the classic between Halloween and New Year's, then your body is going to adjust to that higher weight, and it's harder to get back to pre-holiday weight gain. And so you kind of need to be aware of that. And that's where using the total team approach for how do we get healthy, that's where we come to the experts who are the people in kinesiology, athletic training, those who are over at any of the gyms that we go to, or somebody who we can really trust about the right kind of exercise for you. That's the person that you want to go to. So you go to a dietitian for information about nutrition, and you go to somebody who's expert with the exercise levels. Generally speaking, many of those in the gyms, in not at the SRC, but in gyms that you have all around your city, they're not really trained as well in what's the right amount of exercise for each individual, unless they've gotten a degree in athletic training. And so they may work you too hard, which is going to lead to damaging something. So think about Halloween, New Year's. Think about pacing yourself for the right kind of exercise for you. The other big thing is that many of us, when we think about our level of exercise that we did when we were in our teens, 20s, 30s, for those of us who are beyond the teens, 20s, 30s, our brain still makes us think that we can do that level of exercise, and we really can't. So we need to kind of suck it up and hold on to the fact that, yes, we are a little bit older, a little bit is the operative, and we need to start so that we have a level of exercise that matches up with what is our age, what is our fitness level, and that sort of thing. And that's why I always want to hit the team approach when we're talking about nutrition and exercise. What we were talking about even before we began is and Joshua and I were saying this, and Gary, you can't really do exercise without proper nutrition. And you can't expect to get fit if you're not also incorporating exercise. So they really are intertwined. So let's go look at the next one. And here's what I wanted to talk to you about. And this is looking at a link. You see that big word obesity? All right, when we look at the word obesity, we look at, okay, what is it doing for our risk for different diseases? And so obesity, we can look at it. It does increase the risk for some cancers. I can get you any of the research studies that you want, particularly like colon cancer. It can increase the risk for gallbladder disease because we have some fatty tissues around there. It's going to impact the way our gallbladder can work. It can increase our risk for atherosclerosis. So I want to show you what that is. So here's a vein, clear vein, blood goes through. I've shown you that before. Can you see that? All right, so now if I have, let's see, here we go, too much continuous excess fat, I don't know if you can see this, but that's, I'm going to put it there, plaque that builds up on our arteries, and that makes this difficult to pump. So the more extra calories and fat that we consume that we're not burning, it's a possibility that it's going to line the blood vessels and make it more difficult to pump. So that's where we see, yeah, thank you very much, John. That's where we're going to see that it's going to make it difficult. And that's why it increases the risk for atherosclerosis or clogging of the veins. And then just so that you know, and not to freak anybody out, but I do want to freak you out on this. When you have that lining of the blood vessels with that fat there and the cholesterol there, it doesn't take very much for one chunk of that to pop out, one chunk of that fat to pop out. And if it goes to the heart valve, if it goes to the brain, if it goes to the heart valve, that's a heart attack. If it goes to the brain, that's a stroke. So the obesity again gets linked to all of these things, including and especially the cardiovascular disease. So atherosclerosis, gallbladder disease, type 2 diabetes, it's linked to all of those things. And I mentioned the stroke and heart attack. So we can go on to the next one. And one more further, please, Joshua. There we go. I love this picture that's coming up. Does anybody know what this is? Check it out. Anybody? Sahar, do you know what is it?
Heartburn, acid reflux.
You got it. Okay, see that organ down below where it's green? Can you see that? All right, that's actually our stomach. And can you see the green stuff in it? That's hydrochloric acid. That's what is in our bodies that digests protein. We are supposed to have, if you look at the top of where that green is, we're supposed to have a flap up there that closes to keep the stomach acid in the stomach. We've got lining around the stomach that keeps the hydrochloric acid in there. And this is specifically meant so it's not going to burn a hole or get ulcers in the stomach. But right up at the top where you see the top of the green, that flap isn't working, especially when a person is obese. So as you sit down, everybody is sitting down right now. Imagine this, you've got the hydrochloric acid. You sit down, that pushes the hydrochloric acid up to the esophageal tube into the mouth. And so what you're going to do, because that acid is going to burn that and it's going to affect the teeth, we have a problem with people who have gastroesophageal reflux, it refluxes up, disease, and we see it linked more to obesity. Does everybody understand that? Anybody have any questions about that particular link? Okay, let's go on to the next slide because I want to show you this. I also find super interesting. Remember, my background is also in dental. I don't know if you knew that, but my background is also in dental. And that's where when we go on our trips, I'm teaching dental health and dental nutrition actually to kids in indigenous villages, or we did before this year happened. So what happens with the hydrochloric acid, which is fascinating, that acid comes up to the teeth and it takes the enamel off the teeth. And so it increases erosion or dental disease for populations that have the obesity. And so it's just a complete erosion of the enamel. Isn't that fascinating? It is to me anyway. But so when you see that, that's one of the effects of gastroesophageal reflux disease. So if you go to the next slide, I'm going to show you, and this is if you have a person that you're working with in the gym, or if you're working out and you are experiencing some of that. Now understand that not everybody who is obese, it's not, gastroesophageal reflux disease isn't only affecting people with obesity. If you start to feel where you've got stuff coming up and it's burning, then that just means that the flap that you have at the top of the stomach isn't closing adequately. And so there are little tricks of the trade that we can have you do, and you will see this. So Josh, let's go to the next, click it once. There you go. And so this is what we recommend. So if I have a patient come in with gastroesophageal reflux disease, and they mostly, if they've been diagnosed by a physician, Here's what we want to do. This is, of course, easier said than done. We want to, number one, suggest that you maintain a weight that is right for your body, avoiding obesity. This one we've talked about before. You have smaller meals so that you're not super stuffing at any one meal, because when you super stuff, you regurgitate and it's going to come back. Now, this is one that is almost impossible. Well, no, sometimes I will tell people to eat standing up, so that, because when we sit down, we squish that area of our stomach and it's going to force things up. So if I have a patient who's been experiencing GERD, I'll have them try and eat standing up so that it's got a clearer path there. It's not pushing the hydrochloric acid back up. The other thing is that we want to recommend is that a patient not lie down right after they are eating. Postprandially means right after eating, because when they do, that's going to also push the stomach acid up. And then the other thing, which is, I think, easiest, is don't have food that's too hot or too cold, but just moderate temperature, because if it's too hot or too cold, that's going to kind of, a reflex reaction is reflux. And then also when you're taking notes, what foods tend to trigger that for each individual person? You keep a food journal, and then those are the kinds of foods that would be causing the problem. So for example, I have had several patients who have had a reaction in eating fresh tomatoes. That's when they notice it's an acidic food. So when you can identify what the trigger is, you say, okay, it looks like this. So for 3 days, let's try and have you not eat anything with tomato in it. And let's see if that happens, if that helps it at all. And so we look again for the food journal. Does anybody have any questions on that? Okay, so let's go to the next one. And I want to explain a little bit about type 2 diabetes. So with a person with type 2 diabetes, we generally see that linked to obesity. And we used to not see type 2 diabetes except in people over 40. We've got type 1, we've got 2. There are other kinds that I'm not going to bother to tell you about, but of course, Sahar, you're going to need to know this, and you probably already do. But with type 2 diabetes, what we're looking at is, with a normal cell, when you do not have obesity, that glucose can get into the cell. As soon as you have enough glucose in your blood, it triggers the cell to open and it gets in. With a person who has type 2 diabetes, the cellular membrane just doesn't work as well. It gets in the way, so it's not going to open to let the glucose be metabolized. So it's going to go into the blood and it's going to drive up your blood glucose or blood sugar. And that's what diabetes, that's one of the things with diabetes. So again, type 2 diabetes, obesity increases the risk of type 2 diabetes. And let's move on to the next slide, please, Joshua.
Can you hear me?
Yeah. Yes. Can we go on to the next slide, please?
Can you hear me?
I can hear you.
Oh, okay. Do you know when type 2 diabetes, or when type 2 diabetes was called type 2 diabetes? Because I know it was previously adult onset, because we never really saw it in children. And so
Joshua, that is the greatest question. Thank you, thank you, thank you. Yes, so we used to call it type 2 diabetes if you were diagnosed after 40. But the interesting thing with all this childhood obesity that we're dealing with in our society, we've had 5-year-olds be diagnosed with a type 2 diabetes condition. It wasn't something that was related to their pancreas. It wasn't that there was a problem physiologically or metabolically. It was just linked to their diabetes. So we stopped using adult onset and we just called it type 2 diabetes. And so it can be at any age. What we look at when you do get diagnosed, if you do get diagnosed with diabetes, you need to get a fasting blood glucose. You need to see a specialist who can diagnose it properly. And then we, as a team, will get you the right kind of treatment. If it's a type 1 diabetic, you're not producing insulin, so you need to have that insulin pump. The easiest time, or you have to have some way of getting the insulin in, the easiest way of treating type 2 diabetes is getting them back to exercise and the right body weight. So usually the treatment is, let's just get them healthy. Sometimes, because diabetes can have such a devastating effect on the organs, sometimes we'll put them on a medication, not we, but a physician will put them on a medication like metformin to help control the blood sugar, even if it is type 2 diabetes, until we get them all stabilized so that their blood glucose levels are back to normal. So thank you for that question. That's perfect. All right. Any other? So let's go back to the next one. And with this one, again, it's just what I was saying. One of the problems with untreated diabetes, whether it's type 1 or type 2, do you know what retinopathy, what's the retina associated with? What organ?
The eyes?
Yes, exactly. A+ for Sahar. Yeah. So where we see diabetes, oftentimes, if it's untreated or not managed well, blindness is one of the effects of non-treated diabetes. Chronic high glucose is nerve damage that you see we can see that in the feet. So a neuropathy means that you're not getting the innervation to the feet, and that's where you're going to see the blood flow not good there, down there. And in the old days, I had a grandfather who had the type 2 diabetes untreated, and I was like 5 years old, and I knew that he was blind, but he also had both legs amputated. And that was because way back then, it was untreated, or he didn't follow protocol, and he had gangrene below his knees. So they had to amputate his legs. So we're seeing that. We can obviously have kidney damage because the kidneys are where we process a lot of the nutrients. And if your kidney is damaged, neuropathy, then you need to come to a dietitian along with a renal specialist. And then all the other thing that sometimes will happen, let's say you're not getting innervation to the feet or to the extremities, and let's say you accidentally bang your foot. You're totally not aware of it because you don't feel that pain. So then it's untreated damage, and then that can become infected, and that infection is what's going to cause the need for that will cause the gangrene to set in, and then the surgery to remove the infection. So it's gross. Mostly what we want to do is help people to prevent that. And again, in today's day and age, controlling even whether it's type 1, type 2, or we have other kinds of diabetes that we identify now. There is gestational diabetes that a woman can get, a female can get during pregnancy. So we need to really be aware of controlling that and help our bodies with that. And nutrition comes into that as well. Okay, questions? Any further questions? Thanks. Thank you for that, Joshua. Let's go down to this. And this one is a graphic picture of ulcerative colitis. And do you see, now we're going to pretend like this is the GI tract, and food's supposed to go down there without a problem. And then it goes to the small intestine, the large intestine, the colon. If you have damage from ulcers in that area, this is actually what it looks like. That's the colon. So you can imagine that could be the initiation of colon cancer, right? So ulcerative colitis, again, if you're not eating the proper fiber, if you've got the problems with obesity, if your overall health is not good, these are some of the extreme problems that you can face. But you can see if that's the colon, which is right where the last of the feces are before we excrete them. If that sits around in the colon, you can see all the damage that that's going to cause. So again, not to be graphic, but to be graphic and to point out how important it is to stay healthy. That's kind of what you need. All right, so now let's go to the next one. And this is one of my favorite things. And that's why I'm excited to share this with everybody. If you look at all the different nutrients that are on the left side of that screen, vitamin A, D, E, K, C, and the minerals down below, if you are not getting enough of those specific nutrients, these are some of the deficiency signs that you're going to see. And here we go. This is what Sahar and I teach all the time. If you've got deficiencies in those nutrients, you do not need the supplement unless there's been some other kind of a problem associated with it. But these are the foods that are associated with getting the nutrients from the foods. So if we look back to where Jenny was talking about not having enough milk product or dairy product, what else can you use for calcium? There are green leafies. There are now all of these kinds of substitute milk products and that sort of a thing where you can get the nutrients. But this is a really easy, handy guide that I love for people to have. It's something that I put together. It's really good. One that's really mind-boggling, if you look down under deficiency signs, iron deficiency, notice anemia, small space, you're small in frame, pale, easy fatigue, and depression. We're seeing a lot of depression. The clinicians are seeing a lot of depression accelerating with the COVID, but depression can also be attributed to inadequate nutrition intake. So if you look to the right on that chart or on that page, if it goes back to eating balance, variety, moderation, and of course I always have to throw in the exercise component of it. But look at all of that, and it's about balance. So this one I think is a key tool for everybody to have. Easy, easy, easy. Does anybody have any questions? No. Okay, so let's go to the next one. And again, I'm sending you back to the ChooseMyPlate. And if on the ChooseMyPlate, if you click that link down below just for a quick look, you can click that if you want to, but again, it's ChooseMyPlate, and that's got so much. You can go ChooseMyPlate.gov. Joshua, you don't need to really go to it, but ChooseMyPlate.gov, and that's going to help you set things up so that you can see what is it that you need. How much from each category do I need? And you can actually even keep track of it on an app within that. Okay, so going down two more, sorry about that, I forgot to take that duplicate out, but here's the way that you can keep track. And again, you can print this out from the slideshow. It is really helpful. And these, one more, let's go down one more. These are all of the links that I have given you before when you check fact versus fiction. And these are so good. All of these sites are going to give you realistic information so that you're not concerned about how things are just, they don't make sense and you hear everything. So balance, variety, moderation, exercise. And then we go to the final slide. And there it is. Happy holidays to you with many thanks. And one more little click there, if you don't mind, Josh, and a special shout out to Sahar, to Joshua, to Christopher, who helped, and of course to Dr. Loy. And that's it. That is our journey. So thank you, everybody. And if you have any questions, please let me know. And we are good.
Thank you so much, Dr. Lisagor.
Thank you so much. Happy holidays. Gary, do you have
Thank
any
you.
questions? Do you have any questions, Gary?
No, I do not.
Okay, if anybody has any questions or if anybody comes up to you with any questions about any of this, just give them my email address and that's it. So this was our journey. Thank you, everybody. Happy holidays and stay
I
healthy.
think you have to talk with my brother.
Oh, my pleasure. My pleasure. Thank you, Gary. Nice to meet you.